Welcome to myeyeacademy.com. I'm Professor Mahfooz from Pakistan. This talks number 10 is about the optic atrophy, and the possible questions are: first, we have to define what is optic atrophy, which is atrophy of the optic nerve fibers, and the optic nerve head appears pale or white. What are the causes of optic atrophy, like primary, secondary, conjunctive, and glaucomatous? What are the causes of primary optic atrophy that you will see in the video as it goes along? And what are the causes of secondary optic atrophy? Let's start. Before starting the MCQs, let's go through a couple of slides. Optic atrophy, clinical classification. What is optic atrophy? When the optic nerve stops functioning and becomes white because of the atrophic changes, we call it optic atrophy. There are four types of optic atrophy: primary, secondary, conjunctive, and glaucomatous. In the primary optic atrophy, there are no signs of edema or inflammation, so the optic disc margins are very clear. Look at the optic disc margins. They're very distinct and clear. Secondary optic atrophy is secondary to preceding optic disc, which could be because of different clinical conditions. So because of the swelling, the optic disc margins will be blurry, that you can see here. Then is the conjunctive optic atrophy, which is secondary to a retinal disease. So in addition to the optic atrophy, you can see the retinal disease signs as well. And glaucomatous optic atrophy is secondary to glaucoma, in which the cup is quite big, though the margins are clear. So these are the four types of optic atrophy according to clinical classification. Let's make your concept a bit more clear before going into the MCQs. Secondary optic atrophy could be because of inflammation, ischemia, or papilledema, and the optic disc margins are unclear or indistinct or irregular. Primary optic atrophy, the optic disc margins will be clear but no cupping. In the retinal disease, the optic disc margins will be clear, but there will be signs of retinal disease. And in the glaucoma, optic disc margins will be clear, but the cup will be bigger than usual. So these are the four types of optic atrophy. Let's start the MCQs. Thank you very much for being with me, and please do give your feedback at youtube.com/@Professor Dr. Mahfooz 7544. Thank you.